Have you ever caught yourself wondering whether those little changes in your bathroom habits are just a normal part of growing older, or whether your body might be trying to tell you something more? I'm Dr. Laura, and I want you to know that so many men quietly accept waking up multiple times a night, standing there waiting longer than they used to before the flow even starts, or feeling like their bladder never quite empties all the way. They tell themselves this is simply what happens to every man eventually, so why fight it? I'm here to tell you the truth is far more hopeful than that. Yes, aging plays a role in how your prostate behaves, but many of the symptoms disrupting your daily life are shaped just as much by the habits you repeat every single day. Small, consistent choices can genuinely support how your prostate functions, ease urinary discomfort, and improve your overall health. I'm grateful you're spending these next several minutes with me because learning about your prostate isn't only about avoiding disease. It's about protecting your independence, your confidence, your sleep, and the quality of the years ahead of you. Consider how often prostate issues quietly steer the decisions you make without you even realizing it. Some men skip long car trips because they're anxious about whether they'll find a restroom in time. Others stop attending games or films because sitting through 2 hours feels like a source of stress rather than enjoyment. Plenty of men wake up over and over throughout the night only to drag through the next day feeling worn out, unfocused, and low on energy. Slowly, these small frustrations start to reshape relationships, hobbies, careers, and emotional health. What often surprises my patients is just how gradually this happens. Most don't notice how much their life has quietly rearranged itself around urinary symptoms until they stop and really think about it. But here's the encouraging part. Your body responds remarkably well when you give it the right kind of support. No single habit can promise complete protection from every prostate condition, but research consistently shows that regular movement, nourishing food, quality rest, healthy blood flow, and proper hydration all play meaningful roles in supporting prostate health as men get older. None of these require costly treatments or complicated procedures. Most cost little to nothing at all, yet practiced consistently, they can make a real difference. One misunderstanding I hear constantly from patients in my practice is the idea that prostate health only becomes relevant once symptoms turn severe. In truth, the best moment to start caring for your prostate is long before problems start interrupting your routine. Just like brushing your teeth prevents cavities, rather than waiting for the pain to arrive, tending to your prostate early gives your body its best shot at staying healthy for years to come. Let me take a moment to explain what your prostate actually does. It's a small gland sitting just beneath the bladder, wrapped around part of the urethra, which is the tube that carries urine out of the body. Its main job is producing the fluid that nourishes and carries sperm. Because of where it sits, even a modest amount of enlargement can start pressing against the urinary passage. When that happens, you might notice a slower stream, more urgency, trouble starting the flow, or a lingering sense that your bladder hasn't fully emptied. These experiences become more common with age simply because the prostate naturally changes over time. One of the most frequent conditions I discuss with older men is benign prostatic hyperplasia, or BPH. Despite how intimidating that sounds, the word benign simply means it isn't cancer. It refers to a non-cancerous enlargement of the prostate that becomes increasingly common as men move through their 60s and beyond. Many men experience some degree of this enlargement, though not everyone develops symptoms that actually bother them. That's exactly why paying attention to your own body matters so much. Catching gradual changes early gives you and your doctor more room to talk through practical strategies that might help. I also want to be clear that not every urinary symptom traces back to an enlarged prostate. Infections, certain medications, bladder conditions, diabetes, and even your drinking habits can all affect how often you go and how strong your stream feels. That's exactly why guessing at your own diagnosis is never the right approach. Symptoms that persist or worsen deserve a proper medical evaluation. Many men put off seeking help because talking about urinary or sexual health feels embarrassing. I want to reassure you, as someone who has these conversations every single day in my practice, there is no judgment here. Your questions matter, your concerns are valid, and in most cases, there are genuinely effective options available. My goal isn't simply to help you use the bathroom more comfortably. My goal is to help you keep doing the things that make your life meaningful, whether that's traveling with your family, spending time outdoors, staying active, sleeping peacefully through the night, or simply walking out your front door without mentally mapping out every restroom along your route. Supporting your prostate supports every part of that. Throughout this video, I'll walk you through practical, research-backed habits that fit naturally into everyday life. None of them demand perfection. None require you to overhaul your lifestyle overnight. Instead, they focus on steady, manageable improvements that become easier the longer you stick with them. Often, it's the smallest daily decisions that create the biggest long-term payoff. And the first habit we're going to talk about might surprise you with how simple it is, yet it touches nearly every part of urinary health. It starts with something every man does every day but rarely thinks about strategically, and that's the way you drink water. Most people assume staying hydrated simply means drinking as much water as possible whenever they remember to. Water is essential, no question, but the timing of when you drink it matters just as much as how much you drink. This becomes especially important after 60, when your body's natural thirst signals grow less reliable and age-related changes make the bladder more sensitive than it used to be. Think honestly about your own day. Do you get busy in the morning, realize by late afternoon you've barely had anything to drink, then try to catch up by gulping down several large glasses in the evening? If that sounds familiar, you're far from alone. I see this pattern in patient after patient, and most don't realize how much it's affecting their sleep and comfort. When your body goes too long without enough fluids, your urine becomes more concentrated, carrying a higher load of waste products that can irritate the bladder lining. If your prostate is already enlarged or your urinary tract has grown more sensitive with age, that irritation can make symptoms feel noticeably worse. You may notice a stronger urge to go, more frequent trips, or discomfort that wasn't there before. Then evening arrives, and after realizing you're behind on fluids, it's tempting to down several glasses right before bed. Unfortunately, your kidneys keep filtering that fluid while you're trying to sleep. Instead of a full night of rest, you end up waking again and again to empty your bladder. Interrupted sleep doesn't just leave you groggy the next morning. Night after night, it can chip away at your mood, focus, energy, immune strength, and even your heart health. So, smarter hydration isn't about drinking less. It's about spreading your intake across the hours your body is naturally active. I recommend starting your morning with a full glass of water to replace what you lost overnight and prepare your body for the day. From there, sip consistently through the morning and afternoon, giving your kidneys time to process fluids gradually rather than all at once. As evening approaches, many of us in healthcare recommend easing off unnecessary fluids in the final few hours before bed, unless your own physician has told you otherwise or you have a medical condition that requires a different approach. This one adjustment often reduces nighttime bathroom trips without leaving you dehydrated. What you're drinking matters too. Water should stay your main source of hydration whenever possible. Heavy caffeine, energy drinks, sugary beverages, and excess alcohol can irritate the bladder in some men, increasing urgency or frequency. Everyone responds a little differently, so paying attention to your own patterns can be revealing. I often suggest patients keep a simple log for a week, jotting down roughly when they drink fluids, what they're drinking, and how many times they wake at night. Many are genuinely surprised at how quickly small timing changes lead to real improvement. Hydration supports far more than your bladder. It aids circulation, helps your kidneys clear waste, supports digestion, and keeps your whole body functioning well. Improving one habit like this often creates positive ripple effects elsewhere, which is part of why healthy habits tend to reinforce each other. Of course, hydration alone won't resolve every prostate concern. If you notice blood in your urine, severe pain, an inability to urinate, unexplained weight loss, persistent burning, or rapidly worsening symptoms, please seek medical attention right away rather than trying to manage it at home. Lifestyle habits support your health, they don't replace proper medical care. but for many men dealing with mild, age-related urinary symptoms, adjusting hydration habits is one of the easiest places to start. There's another habit that pairs beautifully with good hydration, and unlike medication or expensive equipment, all it requires is a comfortable pair of shoes and a few minutes of willingness to move. Let's talk about that next. If hydration lays the groundwork for a healthier urinary system, movement is what keeps that system running smoothly. The human body was never built to sit still for hours on end, yet for many men after retirement, daily activity quietly declines. More time in front of the television, more time driving, more time relaxing at home, and gradually, movement becomes rare. Rest matters, of course, but too much inactivity slowly affects circulation throughout the body, including the pelvic region, where the prostate, bladder, and surrounding muscles rely on a healthy supply of blood. One of the most useful forms of exercise isn't intense training or hours at the gym. It's something almost anyone can manage, regardless of fitness level, and that's a simple walk after a meal. Even 10 to 15 minutes of relaxed walking encourages healthy blood flow, helps regulate blood sugar, supports digestion, and eases the low-grade inflammation that tends to build with age. These effects seem small in the moment, but over months and years, they add up to meaningfully better prostate health and urinary comfort. Think of your circulation as your body's delivery system. Every heartbeat carries oxygen, nutrients, hormones, and immune cells to where they're needed. When circulation runs efficiently, your tissues get what they need to maintain and repair themselves. When movement drops off, blood flow slows, muscles weaken, and inflammation becomes harder for your body to manage. Walking won't cure prostate enlargement, but it supports many of the systems your body relies on to keep functioning well. After you eat, your body is busy digesting food and managing the rise in blood sugar that naturally follows. Gentle movement helps your muscles use that glucose more efficiently, softening unnecessary spikes. Better blood sugar control benefits more than metabolism. Long-term metabolic issues have been linked to greater inflammation and a higher likelihood of urinary symptoms in some men, so that short walk after dinner does far more good than most people realize. Many assume exercise has to be exhausting to matter, but consistency beats intensity every time. A relaxed pace that raises your breathing just slightly while still letting you hold a conversation is usually plenty. You don't need special shoes, fancy equipment, or a gym membership. A stroll around the block, through a park, inside a mall, or even pacing your own home during bad weather all count. I've had patients tell me they were sure 10 minutes couldn't possibly make a difference, only to come back weeks later describing better sleep, more energy, and noticeable improvement in stiffness and digestion. Everyone's experience varies, but it's a genuine reminder of how well the body responds to regular movement, even simple movement. Walking also offers benefits beyond the physical. Getting outside for a few minutes lets you unplug from daily stress and clear your head. Chronic stress raises cortisol levels, and while stress by itself doesn't cause prostate disease, it can make urgency, tension, and sleep troubles feel more intense. Gentle activity acts as a natural release valve for both body and mind. If you can walk with a spouse, family member, neighbor, or friend, the benefits often grow even further. Social connection supports emotional health, boosts motivation, and helps you stick with the habit. Instead of treating your evening walk as another task on the list, think of it as time to reconnect with someone you care about and with your own well-being. Not everyone can walk comfortably, of course. If arthritis, balance issues, heart disease, or another condition limits your mobility, there are still good alternatives worth discussing with your provider, such as chair exercises, water-based activity, gentle stretching, or supervised physical therapy. The point isn't matching anyone else's pace or distance. It's simply refusing to let prolonged inactivity become your everyday default. Now I want to turn to a topic many men would rather avoid discussing, even though it plays a genuine role in prostate health, and that's reproductive and intimate wellness. As men age, shifts in hormone levels, circulation, medications, other health conditions, and emotional factors can all influence this area of health. Because of that, many assume intimacy simply matters less after a certain age. In truth, Maintaining healthy reproductive function when it's appropriate and comfortable for your own circumstances can be one supportive piece of overall prostate health and emotional well-being. The prostate produces much of the fluid that becomes part of semen, and like most organs in the body, it tends to function best when its normal biological processes continue on a regular basis. Researchers have explored whether regular reproductive activity may be associated with a lower long-term risk of certain prostate conditions, though scientists are still studying exactly how this connection works. No single factor can eliminate your risk of prostate disease, but maintaining healthy reproductive function does appear to be one piece of a balanced, healthy lifestyle for many men. Beyond the prostate itself, closeness and connection in a relationship offer benefits that reach well past the physical. Affection and healthy emotional bonds contribute to lower stress, improved mood, and a greater overall sense of life satisfaction. These emotional factors influence your sleep quality, cardiovascular health, immune strength, and even your motivation to keep up other healthy habits. It's also worth understanding that changes in this area of health are never something you should just quietly accept. Difficulties in this domain can sometimes point to underlying issues like diabetes, high blood pressure, hormonal shifts, medication side effects, or cardiovascular disease. Rather than treating these as something to hide, I encourage my patients to see them as useful signals worth discussing openly with their doctor. Medicine today offers many safe ways to evaluate and address these concerns, and in many cases, treating the underlying cause improves not just this one area, but your overall health as well. The most important thing I want you to remember is this: caring for your prostate is never about one single habit working in isolation. It's about building a lifestyle where hydration, movement, emotional health, strong relationships, and regular medical care all work together to support your body as you age. Next, let's talk about how the food you choose every day can either support your prostate or gradually add to inflammation without you even noticing. Food has a remarkable influence on the body, yet many underestimate just how much everyday meals shape long-term prostate health. We tend to think of food only in terms of calories or weight, but every meal also supplies the raw materials your cells use to repair themselves, manage inflammation, support immunity, and balance hormones. By your 60s, these processes matter even more because your body's natural repair systems aren't quite as efficient as they were decades earlier. That doesn't mean healthy aging is out of reach, it simply means your daily food choices carry more weight than they once did. Picture your body as a house that stood for many years. When it was new, small problems fixed themselves quickly. As time passes, regular upkeep becomes essential, replacing worn materials, sealing small cracks, protecting the structure before larger issues develop. Your prostate works similarly. Every day, it faces normal metabolic stress, inflammation, and the natural wear of aging. Giving it the right nutrients gives your body its best shot at keeping that tissue healthy over the long haul. One nutrient that's received a lot of scientific attention is lycopene, a naturally occurring antioxidant that gives tomatoes, watermelon, pink grapefruit, and other fruits their deep red color. Interestingly, cooked tomatoes often provide lycopene in a form your body absorbs more easily than raw tomatoes, which is why tomato sauce, tomato soup, or cooked tomatoes can be a genuinely valuable part of your diet. Antioxidants like lycopene help neutralize unstable molecules called free radicals, produced naturally during metabolism but capable of causing cellular damage when they build up excessively. Reducing that oxidative stress supports the health of many organs, including the prostate. No single food guarantees protection against prostate disease, but diets rich in antioxidant-packed fruits and vegetables have consistently been linked to better overall health outcomes. Cruciferous vegetables deserve mention too. Broccoli, cauliflower, Brussels sprouts, cabbage, and kale contain natural compounds. Researchers continue studying for their potential role in supporting the body's detoxification systems and normal cell regulation. They also bring fiber, vitamins, and minerals that support digestion, heart health, and metabolic balance. You don't need expensive specialty foods to eat well. Simple vegetables prepared at home carry tremendous nutritional value. The goal isn't perfection, it's consistency. One extra serving of vegetables a day may feel small, but over months and years, those choices accumulate into real change. Healthy fats matter too. For years, all dietary fat was viewed negatively, but we now understand that the type of fat matters more than the amount. Walnuts, almonds, pumpkin seeds, flax seeds, olive oil, and fatty fish like salmon or sardines all support heart health while helping regulate inflammation throughout the body. Because cardiovascular and prostate health often share the same lifestyle risk factors, improving one tends to benefit the other. Pumpkin seeds specifically come up often in men's health discussions because they naturally contain zinc involved in immune function, wound healing, and normal prostate physiology. Most people can get adequate zinc through a balanced diet, and I always caution patients that more isn't automatically better. High-dose supplements should never substitute for medical advice. Whole foods remain the safest, most reliable source for most healthy adults unless your physician recommends otherwise. Protein matters as we age too. Maintaining muscle mass becomes increasingly important for balance, strength, metabolism, and independence. Lean sources like fish, skinless poultry, beans, lentils, and moderate low-fat dairy help meet your body's needs without excess saturated fat. When meals combine balanced protein, vegetables, whole grains, and healthy fats, blood sugar tends to stay steadier, giving you more consistent energy throughout the day. On the flip side, diets heavy in processed foods tell a very different story. Added sugars, refined carbohydrates, excess sodium, and unhealthy fats can contribute to chronic inflammation, obesity, insulin resistance, and cardiovascular disease. And these conditions ripple out to affect nearly every organ system, including your urinary tract and prostate. This doesn't mean giving up every favorite food forever. Healthy eating isn't about guilt, it's about balance. An occasional dessert or celebration meal isn't what determines your long-term health. Your regular daily pattern matters far more. I often tell patients to focus on adding nutritious foods rather than fixating on what to avoid. Once your plate fills naturally with colorful vegetables, fruits, whole grains, lean proteins, and healthy fats, there's simply less room left for foods offering little nutritional value. This mindset feels less restrictive and is usually much easier to sustain for years rather than weeks. Portion size deserves attention too. As metabolism slows with age, your body typically needs fewer calories than it did in younger adulthood. Eating slowly, tuning into hunger cues, and avoiding oversized portions all help maintain a healthy weight. Excess body fat, particularly around the abdomen, has been linked to increased inflammation and higher risk of several chronic diseases, so maintaining a healthy weight becomes another indirect way of protecting your prostate. Remember, nutrition is only one piece of a much larger picture. It works best alongside regular movement, proper hydration, quality sleep, routine medical care, and stress management. These habits reinforce each other, building a foundation for healthy aging rather than relying on any single miracle food. Speaking of foundations, there's one habit many people sacrifice first when life gets busy, even though it shapes hormones, immunity, tissue repair, and overall vitality more than almost anything else. That's sleep. And I want to explain why truly restorative rest may be one of the most powerful, underrated ways to support your prostate after 60. Quality sleep often gets treated as a luxury, something we hope to squeeze in if time allows. But medically speaking, sleep is one of your body's most important repair systems. Every night while you rest, your brain and organs run a carefully coordinated recovery process. Hormones rebalance, damaged tissue repairs itself, immune cells become more active, and inflammation gets regulated. These processes work quietly in the background, yet they influence nearly every part of your health, including your prostate. As you get older, protecting this nightly recovery window matters just as much as eating well or staying active. Unfortunately, many men over 60 believe poor sleep is simply something to live with. They wake 2 or 3 times to urinate, struggle to fall back asleep, and start each morning tired instead of refreshed. After months or years, exhaustion starts feeling normal. But your body never truly adapts to chronic sleep deprivation, it just keeps paying the price quietly. During the deepest stages of sleep, your body releases hormones that regulate inflammation, support tissue repair, and maintain normal metabolic function. Healthy sleep also supports balanced testosterone production, which naturally shifts as men age. Testosterone is only one factor in prostate health, but maintaining hormonal balance supports muscle strength, energy, bone health, mood, and overall well being. When sleep fragments night after night, these repair systems become less efficient, stress hormones stay elevated longer, inflammatory markers may rise, and your immune system can't function at full strength. Research consistently shows that people who sleep poorly face higher risks of cardiovascular disease, type 2 diabetes, obesity, and reduced cognitive performance. Sleep alone doesn't determine prostate health, but it's one of the foundational habits that helps your entire body function well. Many patients ask me whether waking to urinate is causing their poor sleep or whether poor sleep is making urinary symptoms feel worse. Honestly, the answer is usually both. An enlarged prostate can interrupt sleep through nighttime urination, while inadequate sleep can make the bladder more sensitive, lower pain tolerance, increase fatigue, and reduce your ability to cope with normal symptoms. It becomes a frustrating cycle, and breaking it usually means addressing both sleep quality and urinary health together. The good news is improving sleep hygiene doesn't require expensive equipment. Small, consistent changes go a long way. Keeping a regular sleep schedule, going to bed, and waking at roughly the same time daily helps regulate your internal clock over several weeks and improves deep sleep quality. Your bedroom environment matters too. Cool, dark, and quiet signals your brain it's time to rest. Blackout curtains, comfortable bedding, and reducing noise all help, and even small light sources like a bright digital clock can interfere with melatonin production. Screen exposure before bed is another common obstacle. Televisions, phones, tablets, and computers emit blue light that delays your brain's natural wind-down process. Swapping the final 30 to 60 minutes before bed for reading, calm music, gentle stretching, or quiet conversation helps your body transition more naturally into sleep. Your evening eating habits matter as well. Large, heavy meals right before bed can cause discomfort that interferes with rest, and drinking excess fluids late in the evening raises your odds of waking to urinate. As I mentioned earlier, spreading fluid intake across the day rather than loading up before bed supports both sleep and urinary comfort. Caffeine deserves a mention too. Most people know coffee affects sleep, but caffeine also lurks in tea, soft drinks, energy drinks, chocolate, and some medications. Since sensitivity varies from person to person, tracking your own response helps you decide whether cutting back in the afternoon or evening improves your rest. Daytime activity supports better sleep too. Men who exercise regularly often fall asleep more easily and sleep more deeply. Though timing matters, gentle activity earlier in the day usually helps, while vigorous exercise right before bed can leave some people too wired to relax. It's also worth knowing when poor sleep needs professional attention. Loud snoring, pauses in breathing during sleep, excessive daytime drowsiness, or waking up gasping may point to obstructive sleep apnea, a condition that becomes more common with age and can significantly affect heart health and overall well-being. It's treatable, and proper care often brings noticeable improvement in energy and quality of life. Persistent insomnia deserves attention too, regardless of age. Effective treatments exist, and it's always worth raising ongoing sleep struggles with your provider. As we bring these habits together, a clear pattern emerges. Healthy aging rarely comes from one dramatic decision. It's built through small actions repeated consistently. Thank you for spending this time with me and investing in your own health. I sincerely hope this discussion has given you practical knowledge, some reassurance, and the confidence to take real steps towards supporting your prostate and your overall well-being. If you found this helpful, consider sharing it with someone who might benefit from hearing it too. Too many men still struggle quietly simply because these conversations rarely happen. The more we talk openly about this, the more lives we have the chance to improve. Take care of yourself, stay consistent with the habits we've discussed, keep an honest line of communication with your healthcare team, and remember, healthy aging isn't about perfection. It's about making better choices one day at a time. Thank you for watching, and I'll see you next time.